1993 health care proposal. She admits she learned from that, and the new plan is different. It does not try to remake the world of medicine. Mrs. Clinton would rely on a mix of existing insurance plans. People who like their insurance would keep it, and their employers would get tax breaks to provide it. Those without insurance would get help paying for it, and no one would be denied for pre-existing conditions. But what if insurance companies found it unprofitable to stay in business?
We used to have a nonprofit health insurance sector, as you remember, and there was a big rush to turn all these nonprofits into for-profits, and CEOs took huge payouts, and all the executives started paying themselves all this money. They went into the stock market and they started getting stock options. I'm sorry, that just doesn't work for health care.
Senator Clinton's plan also asks doctors and patients to make some adjustments.
In my system, it's premised on shared responsibility. Everybody's going to have to take responsibility. Providers, patients, payers, all of the big institutional interests like insurance companies and drug companies.
Senator Clinton also talked about her August visit to St. Rose Hospital in Henderson. She shadowed nurse Michelle Estrada and saw her spend 15 minutes deciphering a doctor's handwritten order. Clinton says her plan would do away with problems like that, saving $77 billion by computerizing doctors' paperwork and by providing secure electronic medical records for every American. As they say, though, the devil's in the details, and the new plan would require federal regulations.
Otherwise, we're going to have a disorganized system that continues to cost more and more. Fewer and fewer people will be able to access it. More and more doctors, nurses, and others will get discouraged. And the high quality of care that we have still as the American hallmark will be available to fewer and fewer people.
Senator Clinton did not discuss her rival Democrats' health care proposals, which are not essentially different from hers.
And Senator Clinton says her reforms do not amount to a government-run plan or an added government bureaucracy. Clinton says nearly 1 in 5 people living in Nevada have no health insurance, including 100,000 children that live in our state.